March is Colon Cancer Awareness Month, and this is a great opportunity for us to talk about one of the cancers that, if detected early, is probably the most treatable and survivable of all of the cancers. As usual, joining me today is Dr. Uribe, and you've brought a guest.
Right, I'd like to introduce Dr. Christopher Botan, who is a GI specialist at Elmhurst Clinic, and coming here to talk with us today and give us more information. If you want to introduce yourself and give us a little bit about your past.
Yes. Thank you, Dr. Uribe. My name is Christopher Botan. I am a GI specialist here at Elmhurst Memorial. I've been on staff at Elmhurst Memorial since 2006. Other hospitals I've worked at out of Gottlieb Memorial in Melrose Park, also Edward out in Naperville. I actually finished my training in 2006. I trained at University of Illinois in Chicago, lived in Chicago for over 10 years, and finished my fellowship training for GI at Cook County Hospital.
And you originally started in Chicago, so you're really a Chicagoan.
Yes.
Well, very
Very
good. We're happy to have you, and we're happy to have you here at the Addison Center for Health. To be accurate, Dr. Uribe, we're today talking about colon rectal cancer.
Correct.
And you're a gastroenterologist.
Mm-hmm.
So let's refer to that from here on in as the GI. Okay, it's a lot easier for me to say.
That's what they call us, yes.
Yeah, and we really want our audience to really listen to this show. This is so very, very important, especially that it's so survivable, it's so treatable, mm-hmm. and it's becoming very common. Dr. Uribe, did we say earlier that this is the fourth
most common cancers in the U.S.
Wow.
Correct, so very common. One thing we talk about too is just to tell the audience what GI doctors do, like what kinds of illnesses that you deal with
mm-hmm.
with patients, just so patients understand that.
Absolutely. So GI stands for gastrointestinal or gastroenterology. People come to see me for a variety of things, anything from their swallowing in their esophagus down to anything in their abdomen. People will come to see me for heartburn or difficulty swallowing, for stomach problems, dyspepsia, many varieties of abdominal pain. We take care of intestinal disorders, chronic problems such as Crohn's disease or ulcerative colitis. Those are some of the intestinal diseases we treat. We also care for liver trouble, hepatitis, gallbladder disease, and gallstones, as well as pancreatitis.
See, the gallstones, I would have never even thought to come to a GI. You go to your general practitioner, mm-hmm. And then they would probably refer you to a GI would refer mm-hmm. to a GI?
That's a team approach. Certainly a GI, often a general surgeon as well. Gallbladder, gallstones, many of the problems I take care of, I work closely with one of our general surgeons.
Okay. But today we want to talk about colon rectal cancer. It is so important.
Right. So apparently it is very common. It's the third leading cause of cancer-related deaths. 49,000 expected in 2016. But the important thing for people to know is that the death rate is decreasing, and there are many more survivors than there used to be. So we want to talk about a little bit more of like who's at risk and kind of ways to prevent some of these cancers. First of all, what is colorectal cancer? Like, what is it? What is cancer?
Colon cancer is a tumor, a cancer growing in the lining of the colon. The colon is the large intestine. It's the last 3 feet or so of the GI tract. It starts in the large intestine, and it spreads fairly quickly to the things around the colon, almost always the liver, and goes on from there.
You know, one thing, that commercial is terrific with the little cartoon character, but it looks like he has miles and miles of intestines. You have a lot of intestine.
Yes.
So there's a lot that can go on in those intestines that and actually with colon cancer, one of the biggest survival techniques, I believe, is to remove sections of the
Correct.
colon. So it's not something people should be afraid of. You have plenty of it to go, you know. So you really need to take care of it, and that's that little cartoon. It does show that it has a lot of intestine. Mm-hmm. Am I correct?
Yes, you have quite a bit of small intestine and over 3 feet of large intestine.
Wow.
For a variety of reasons, these cancer of the GI tract almost never happens in the small intestine. It's always in the large intestine. That's a blessing because it's a very easy place to examine. And also, like you said, the colon, it's one 3 or 4 foot long stretch of intestine, but it's very easily divided. You can take parts of it out if someone has a cancer. It's a very simple surgery to remove just a section of the colon to get a cancer out of someone.
See, that's what it fascinates me because it sounds so, it's easy. So catch it early, catch it when it's the easy thing to do. You know.
Who's at risk for colon cancer? Like who needs to be more cautious or get screened?
It's a very good question. The best answer to that question is everyone. We check everyone because there are many colon cancers that are spontaneous, that happen without warning or without any risk. That's why screening people without any symptoms, without any abnormal tests, just because they're at the age where they need to be screened is important. But there are a few things that make us worry a little more, especially things that make us start checking people before the average age where we start screening people. There are several risks. The thing we take note of probably most often is if it runs in the family. If there's a parent or a brother or a sister with colon cancer, or if a parent turned up with colon polyps, especially young in their 40s or 50s. There are many genetic components of colon cancer, so we'll check someone sooner if it runs in their family. Other risks are similar to some of the other health risks. Smoking is related to colon cancer. Diet and choices of your diet, the more red meat, the more fat and fried food and fast food in your diet. And there are connections with other chronic diseases, even diabetes and being overweight. Those are all things that increase your risk.
Well, you said polyps, you mentioned polyps. That's like a little blip that's in the colon. Is that what turns into the tumor?
That's where colon cancer begins, and that's a really important thing you bring up. Most cancers we treat in medicine just happen. Someone feels a lump and goes to get diagnosed and they find out it's cancer, and that's where it starts. The beauty and the tragedy of colon cancer is it starts as a colon polyp. A colon polyp is a little growth, like you said, it's a little blip. The small ones look like a little wart or a little mole growing inside of the colon.
And that's inside of your colon, inside the colon.
And the lining of the colon. You don't feel it, there's no symptom, it's tiny. And this little polyp, this thing which will turn into colon cancer eventually, sits there growing without symptoms, without bleeding, without you knowing it's there. 3 or 4 years, probably up to 10 years before it mutates into cancer. So not all polyps turn into cancer, but every colon cancer started as one of these polyps.
Really? And that's removed without surgery? You can remove a polyp without surgery? Do I understand that correctly?
Yes.
When you're having a colonoscopy, if they see a polyp, they can actually remove it at that time?
Yes. And that's actually the big idea with colonoscopy exams. Because many people would expect, well, you're going to check me for colon cancer. You're going to see if I have a cancer in there. And we do find colon cancer, not as often as you'd think. Maybe every 1 or 2 months I find a colon cancer during colonoscopy exams. But what we're doing during a colonoscopy, especially screening people, is looking for those polyps. Because again, we have a window there. A polyp is going to sit inside someone without any symptoms for anywhere from 3 to 10 years before it's big enough to mutate into cancer. So during a colonoscopy, with somebody cleaned out, prepared for the exam, when we pass a scope through their large intestine, their colon, we can see those things and we can cut them out. It takes me 2 or 3 minutes to cut a small polyp out. It could take 10 or 20 minutes to cut a large one out. There's no pain that happens during the procedure. There's no second procedure. And when the person wakes up, the polyp that would have become cancer has been removed.
And they don't even know it?
And they don't even know it.
See, it's so simple. And it's just something that I feel people really have to understand how simple and easy it is to do if you do it early. Right. And Dr. Uribe, you're a pediatrician. How young, have you ever seen children?
Never see it in children at all. Of course, I've had parents of children have different types of cancers, but we never see it in kids. But we'll talk about later, I think, prevention stuff, which probably starts from the beginning of life to keep some of these cancers from happening. Mm-hmm. So. Well,
especially when you say eating habits and what you eat, and fast foods you mentioned, and fried foods, and that's kind of where pediatrics comes in, because if you teach them at a very young age, it just becomes a natural routine. That,
Right.
you'll eat the right things without even realizing it. It's what you grow to like.
I think we talk a lot about nutrition and prevention, and when we tell parents for the kids' sake, it also hopefully influences the parents to eat healthier. And I think young adults, the patients, if I have parents who are in their 20s, early 30s who are healthy, don't tend to go to the doctor very often. So hopefully it starts with us, where we talk to them about good nutrition, good health habits, to encourage that as they're getting older, and get the kids in good habits so that they have good health in the future, less chance of cancers.
Well, I think so often you find that parents are more concerned about their children than they are about themselves.
Right.
So you start with the kid and you grow into the parent, and they all learn together, But smoking, that kind of surprised me.
That's a big deal. Smoking is a major risk factor for many of the cancers I help care for. It's a major risk factor for esophagus cancer and for stomach cancer, also pancreatic cancer, and definitely colon cancer as well. Dr. Uribe mentioned it's just another example of healthy lifestyle choices. We know so much about how many ways smoking harms you and is going to shorten your life. This is another example. It's a risk factor for colon cancer.
And many other diseases and cancers. Dr. Uribe, earlier before the show, we were talking about some celebrities that you actually found that through
Right.
smoking had issues.
Right, and some related to different viruses too. We were talking about some of the vaccines too. Like one of the vaccines we promote is the human papillomavirus vaccine, and that virus causes different types of cancer, some throat cancers and also anal cancers. So Farrah Fawcett was one who died of anal cancer, and that type of cancer can be caused by HPV, which is a virus, and we now give vaccines to adolescents to prevent that virus. So at least one type of cancer we can try and prevent.
From an earlier age.
From the vaccine, exactly.
From an earlier age. And you
Right.
said something else about, was it Michael Douglas that?
Had a throat cancer, which also can relate it to HPV. Right.
Okay. So it's all kind of comes together. You have to be healthy. You have to do what you need to do. But as I said, this is a topic that I think people really, really need to know about, and I don't think they pay as much attention to it as they should.
Right. We also mentioned, I think, Katie Couric, who's very involved with colon cancer awareness because her husband passed away from colon cancer. So
At a
many
young
people are aware
age,
of it. At a
really?
young age, right, right.
At a young age.
Right.
So if there is a family history, then you do
Take
start.
that very seriously.
Right. What's a typical age to start colonoscopies?
So that's a very good question. The average person, a healthy person with no risks, no symptoms, we start checking at age 50. That comes from a lot of data and research showing that polyps start showing up in people's 40s and 50s, and colon cancer starts turning up on average in most people in people's 50s and 60s and 70s. So 50 is about the right age to start getting checked. And it's a screening exam. There are no symptoms, just somebody that's coming in for the routine checkup, getting their cholesterol and their blood pressure checked. We start screening people at age 50 for colon polyps or cancer.
And how often do they have to get further colonoscopies?
That's a really good question, because most people are afraid they have to come every year or every 2 years. The average person comes back for their next colonoscopy every 5 or 10 years.
Okay.
And that goes back to the tragedy of how slow growing this cancer is. It takes so little to prevent it. Getting a colonoscopy every 5 or 10 years is generally enough. We look a little more often if someone surprises us and does have unusual number of polyps or unusually large polyps. But most people, it's every 5 or 10 years.
And most people I know who are in their 50s get very scared of having colonoscopies done. So what is the process? Like how does it go with, are they aware, are they awake, are they sleeping?
Absolutely. One of the best things that Katie Couric did, she got the word out and really made it a public conversation, colon cancer and colon cancer prevention. But the other thing which she really went out of her way to show was how easy and how tolerable a colonoscopy is. To take away the mystery and to take away the fear of the exam. It's an outpatient procedure. And the good news is we give people sedation for this. There's a variety of ways that we sedate people. Some people choose to be just lightly sedated, where they're kind of in a twilight and they're sort of aware, sort of not aware, and the whole thing is kind of a blurry memory afterwards. Other people that are nervous or would prefer to be deeper asleep can be pretty much fast asleep. If we put someone under deeper sedation, They don't even know the exam happened. 1 minute they're watching us get ready in the procedure room, and the next minute they're waking up 20 minutes later and we're telling them it's finished.
Okay.
So it's a very tolerable experience. The colonoscopy is a day and a half of your time. The day before, people have to do a clean out. They have to get ready for it.
Which is actually good for your health too, though.
It is a complete purge. You are emptying out. The good news about colonoscopy is that's actually the worst part. The night before, somebody coming in for a colonoscopy has to drink a special laxative and literally wash out their intestines for us. So they need to be home the night before getting ready. The day of the exam is a day off. You can't drive a car or work or sign a new will that day.
It is so relaxing. It's a day of really, don't
Yes.
sign any wills, don't drive a car, just sit down with a remote control and watch television.
Exactly.
You know, it really is that simple. But you said 50 is the age. What if there's a family history? Do you start before age 50?
We do, and that goes back to this idea of getting a head start. If someone's destined for colon cancer, there's going to be polyps for years before there's the colon cancer. So we want to catch polyps before they turn to cancer. So the rule of thumb is generally 40 when there's a family history, a parent or a sibling. If there's something unusual where it was really young and the parent or sibling, we go 10 years earlier. So if a parent had colon cancer at 45, we might actually start checking someone at 35.
Really? Okay, because that to me is important. It's a very hereditary type of thing. Is that the
Yes.
right word for that?
Yes, it's a strong genetic component to it. So we do take note. When it runs in a family, it goes two ways. We need to check someone who comes in and says, oh, by the way, my mother passed from colon cancer. Looking at it from the other direction, when we find colon cancer in somebody, we tell them your brothers and sisters or even your children need to be checked because it can run in families.
Now, we've got about 4 or 5 minutes left, and there's some things that, what causes a polyp?
Well, that's a tough one. Genetics is part of it. There are people that are predisposed, especially earlier in life. People may start growing polyps sooner if it runs in the family. But again, some of the risks we were discussing earlier, diet, red meat, fried food, fast food, junk food, smoking, those are some of the risks that predispose to polyps.
Go ahead.
I was going to ask, if you do get to the point of getting the cancer, what are the symptoms that people should look for? We're trying to prevent it all, but if you do
That's
get
important.
cancer.
And that is also important because these symptoms only happen very late. So if someone's coming to me with colon cancer that's causing them symptoms, generally it's going to be spreading, it's going to be in multiple places, and it's going to be a very serious conversation with chemotherapy and possibly not curable. The symptoms of colon cancer are when it's starting to bleed or even starting to cause someone a blockage. So people may come in saying they're seeing bleeding, and when they go to the bathroom, blood in the toilet. They may notice that they've had a change in their digestive pattern and their transit. They were regular all their life, and suddenly they've been kind of constipated for a month or two. Or pain. People have a new constant abdominal pain they didn't feel before. It doesn't go away. It's kind of the same place every day. Those are some of the common symptoms we get.
Well, see, and that's so very important because once the symptoms show up, that's when it's a big problem. That's why the colonoscopy is so efficient, I should say.
Well, it's extremely important. Since there's no symptoms, there's no red flag to say, maybe I should get checked. That's really why we check everyone before they have symptoms, because you don't feel polyps and you don't feel an early cancer. When we find small cancers, often the person did not have any idea they were in there.
Now, we're running short on time, but I have a couple of very simple questions. Is there a blood test that can show a possible onset of colon cancer?
There is not, but there is a stool test. It's not considered equivalent to a colonoscopy, but for people that cannot or will not have a colonoscopy, there's a fairly accurate stool test for colon cancer.
So there are other alternatives or something they could start with if they're very paranoid about colonoscopy?
And there's also a CT scan. They call it a virtual colonoscopy. So there is a CT scan where they can x-ray the colon and see larger polyps, possibly cancers.
Okay. See? Didn't know that. So and when you say no red meat and all that, you don't mean totally. You mean
Absolutely not.
in moderation, but
In
like
moderation.
everything else in moderation.
In moderation, just part of a healthy lifestyle.
Well, that's what we're kind of encouraging everyone to do, to have a very healthy lifestyle. Dr. Uribe, you start that. You're the beginning. You're when
Right.
you start teaching the children and their parents to have a healthy lifestyle and to take the appropriate tests, the appropriate vaccines.
Right.
That's where it starts.
It's actually educational for me too, because I'm learning a lot about colon cancer, which I don't deal with, but I think it reinforces what we do, and trying to teach good health habits, exercising, not smoking, watching obesity, things like that we've talked about. So trying to encourage that, and I'm going to start talking to my parents to make sure they have a doctor to go to, because you want to just not ignore these symptoms and get screened early.
Yeah, exactly. Get screened early. That's I think the whole point of this entire program. Find out early, fix it early. It's treatable, it's survivable, and that's why you have to see your general practitioner and your GI. And I would like to know what each of you has to say about. What's your last words on this? What do you really think you want to put out to our audience today? Dr. Uribe, you first.
I would just encourage people to have a general doctor. As an adult, to have a primary care physician who can help guide you on these guidelines of when you should do certain things to help you in good health, and get you to the specialist when you need to.
Just to sum up, a colonoscopy takes about 20 minutes. You're in the building or the facility about 3 hours. With the sedation, it's easy. Most people wake up and don't even realize we've done the exam. The best way to summarize how easy this is some of our customers that unfortunately have to come back sooner, in 1 or 2 or 3 years, don't mind coming back for their next exam. When people wake up and get up and go home, they say, that wasn't so bad, I can do it again.
That's what we need to know. Well, we really are running out of time. This was a lot more information than I thought we wanted to get out today, but I love it. It's terrific. So I want to thank you both for joining me today, and thank you for joining us today, Christopher.
An honor.
Thank you for our audience for joining us. I'm Lucille Zucchero with Dr. Uribe and Dr. Christopher Boudon.